Hello, I'm Pearl Venema, Chief Executive Officer of Hamilton Health Sciences Foundation. Shelley Amodeo is a registered nurse who works in the Neurosciences Ambulatory Centre at Hamilton General Hospital. Today, she'll be speaking about the use of virtual care in ways that essential services are continuing for neuro and stroke patients. For today's episode of Innovations in Vital Care, it is my pleasure to introduce Shelley Amodeo.
Good morning, everyone. My name is Shelley Amodeo, and I'm one of the nurses that work in the Hamilton Multiple Sclerosis Clinic at the Hamilton General Hospital. At the clinic here, we work in the Neurosciences Outpatient Clinic. It is a large clinic servicing patients with neurological diseases, including we have the regional stroke prevention clinic, epilepsy clinic, the neuromuscular clinics, epilepsy clinic, and movement disorders clinic as well here. I work here in the MS clinic with a multidisciplinary team, which includes neurologists who specialize in MS, physiatry, doctors who are training, and nurses as well that specialize in MS, and a social worker, as well as our clerks that keep the clinic running. We work here diagnosing and treating individuals with MS in our community. Over 6,000 patients that we provide care to. And we also assist their family members in this long course of the disease, and provide research opportunities as well. I work, like I said, as a registered nurse. My main role in the clinic is for education, to educate patients and their family members about MS, and as also for support in navigating this chronic disease and self-management of it. So we also support their complex needs, which includes symptom management and navigating resources to help them through the course of their disease. I help them access MS therapies and also monitor responses to those therapies. During this whole COVID-19 crisis, things have changed quite significantly in the clinic. As you can imagine, we've adopted virtual care here in the clinic, and the main piece of that is virtual visits, which basically are appointments with doctors or the healthcare provider that don't involve an in-person meeting. So these can be done via telephone call or a smartphone computer, which would be a video visit, and it really depends on the individual patient needs, as well as the needs of the clinic. And we've been mixing those in with some in-person visits as well when they're more urgent and require an in-person visit. These visits have been taking place with physicians as well as the nurses, and social work visits as well. And this way we've been able to minimize in-person visits and the number of people coming to the hospital, which obviously protects patients, staff, and the community from the spread of COVID-19. And doing this, we really maintained access to care during this time without exposing staff or patients to unnecessary risk. And there's been very little, except for maybe the very beginning, disruption to previously booked appointments by moving to virtual care. So a virtual visit, what does it look like? It's basically the healthcare team here we would contact the patient, and we would just determine their individual needs, as well as the needs that the clinician requires for the patient. This might be done via telephone, smartphone, or again, the video visit. Video visit here in the clinic, we're using the Ontario Telemedicine Network. It's OTN. We've been using it here previously, but just not just on a rare occasion. So this is a little bit newer for us. And the way the patient would experience it, we would email them with an appointment, with instructions. It's usually quite easy to navigate. And if there's any problems, then we can always, with a video call, we would move to a telephone call instead. And then the patient would experience this virtual visit with the physician or healthcare provider in a secure environment. there's lots of benefits of virtual care, especially for the patient, I think. There's safety, of course, because we can maintain physical distancing. There's the convenience, which is the patients are able to do it in the comfort of their own home and their setting. This really, really does benefit patients with disabilities as well. And it eliminates travel. So some of our patients are coming from extremely long distances, for even 3 hours away. So there's time. Of course, there's more availability because they don't have to, add in all this travel time, and the associated cost, which would include gas or even transportation for these patients that come via transport. And then, of course, childcare. So you don't have to arrange childcare when you're coming into the clinic. For the clinician, I think that we really benefit as well because we can save time, commit to shorter calls. There's less delays with patients arriving late and things like that. And then the space as well, there's less space required. So we can see patients in more patients, and with patients coming with family members in large groups, they can do that right in the comfort of their home, and we don't require a large room. And then, of course, physicians who are working at different sites can do these visits from different locations as well. So that's great. That is the MS clinic and the Neurosciences Ambulatory Clinic. Do you have any questions?
Thank you so much. That was wonderful. So that was a lot of interesting information. And with the COVID response and the COVID crisis, things have had to change so quickly. You had mentioned that there really was only minimal disruption at the beginning of this whole pandemic. My question for you is how did you and your team manage to mobilize so quickly? It seemed like you had to react on the fly.
Yeah, I think there was a little hiccup in the beginning. Everybody sort of had to rethink how we're going to do everything. But we really wanted to minimize disruption to patient care. So our managers and our team, we all really looked at processes, and we're able to look at virtual care, which has been available. Most of our neurologists have used it. Some of our social workers were using it already. So they were comfortable with some of the platforms. So they really helped us, and we were able to start seeing patients that way. We started with a lot of phone calls at first as we tried to, learn these new platforms.
Yeah, and you mentioned how there are several benefits for patients, including patients coming in from communities that are pretty far away. And what I think a lot of people don't realize is that although it's called Hamilton Health Sciences, it actually has quite a large catchment area. Could you tell us a little bit about some of the other communities outside of Hamilton that you serve?
Absolutely. Yeah, of course, Hamilton, Niagara, we see patients from Niagara, we see patients towards Toronto, in Burlington, Oakville, some in Mississauga. We go up to Guelph, Waterloo area, and that's the major areas, but we do see people from Northern Ontario as well, because there's not the availability of MS specialists in those communities, so they do, some of them fly here. Yeah.
And you mentioned that there are some urgent cases where patients would still need to come into the hospital. Could you describe sort of what conditions situations where a patient would actually still have to visit the general?
Yeah, for our clinic, often, there's two scenarios with our patients in the MS clinic in particular. One would be a follow-up appointment. So a lot of times our physicians are quite familiar with their issues they've had, so we're able to sort of see them. We follow some of these patients for 25 years, so we know them, and a virtual visit would probably be good enough for us, because we can see things and we know what they were like before. But when you're doing the first assessment, it's usually a little more difficult, because a neuro exam does require some element of physical touching, basically, because we need a neuro exam, we need to test strength, things like that. And we're not able to necessarily test strength in a virtual visit. So we ask the patient, they are able to tell us things, and ask them to lift their legs and do things on the video, but we can't actually apply force and pressure and get the exact things. So, and in MS, we do look for something called disability scales, which actually is part of the process in getting them approved for therapies, and we need these scales. So that is a little bit tricky with some of our patients, but we've been managing pretty well.
Good. And I understand across Hamilton Health Sciences, there are many sort of disinfecting protocols being put in place, a lot of different special processes put in place to ensure that everybody is safe as well. So
absolutely, yeah. Our clinic, we've got lots of protocols. It's I think, very safe environment at this time. As things reopen, as things get ramped up a little bit more, and we increase patients coming into the clinic at some point, I think we're going to have to even continue to change how we're doing things. But at right now, I think I would say that I feel safe here seeing patients, and I think patients can feel safe coming into the clinic.
wonderful. And for you personally, what part of your work do you enjoy the most?
Oh, I really love my job. I'm really fortunate. I think for patients here in the clinic, for any patient coming into the hospital or just requiring healthcare, when they're in a crisis, when they are unwell, it's a very physically and emotionally challenging time for them. And they really require support. And I feel really blessed that I'm able to support patients on their, throughout their whole healthcare journey, especially with chronic disease. Like I said, some of these, I've been here a long time, over 15 years. And a lot of these patients I've known for all those years and been able to be there for them as the disease changes. And things change over the years with this disease. So I'm there to support them. And I'm very lucky. I love my job.
Well, thanks so much, Shelley. We really appreciate you joining us today. And thank you.
Thank you so much. I appreciate it. Take care. Have a great day.